I'm Jan Hessler, and I'm a registered nurse in the cardiac rehab department. Congestive heart failure is a chronic disease that affects hundreds of millions of people in the United States. And we know that it causes frequent readmissions to the hospital because the symptoms will reoccur. And if patients are provided with good information and then we help them to retain that information and empower them to take care of themselves better at home, then we hope that they can stay home and stay out of the hospital longer. Well, we were gradually trying to improve our program with the telemanagement that we do. And we started including more things like really going over medications in more detail and so forth with patients. But we realized that when we called, a lot of times people didn't remember very much of what they'd heard in the hospital. And they weren't clear on a lot of things. And going over a list of medications on the phone just wasn't really effective. So we wondered how we could make or help them to better retain the information, how we could make it more clear to them. And we thought, you know, how better than if we were sitting in their home with them where they're comfortable. Statistics say that patients only remember maybe 10 to 20% a lot of times of what they're taught in the hospital. So we decided that maybe this would be a good idea. And we did find some literature and see that that was something that other hospitals in the country had done. Because congestive heart failure does bring people back into the hospital so often, we want to do everything we can to help people manage their care at home. There is no charge to the patient. It's a service we provide, especially to help them stay healthier and take care of themselves better. We've seen readmissions decrease with our home visits. We did our own little study and we did see that over a year's time, the patients that we did home visits with, about 1.5% of them had readmissions within 30 days, and the ones who did not receive a home visit, about 8.5% of those had readmissions within 30 days. I think it's important that we have that connection with the patients, but everybody is very welcoming to us, and a lot of times when we leave, they'll give us a hug and thank us for being there.